I've been in business with Kurt for approximately 10 years. We started doing physicals together with what we call an executive physical, where we do ABIs, pseudoscan, Dopplers of carotids and abdominal aorta and spirometry. We added all that to the physical and we just made it part of our routine protocol. And it really increased patient satisfaction. Patients seem to really like the fact that we have this extensive physical. They go to work and they talk to their colleagues and they're, wow, you did all that stuff at the same time. I didn't get any of those things done. So it increases your patient volume by patients talking to other patients at work. It also hits your HEDIS measures. A lot of the new guidelines with Medicare, they're looking for screenings for ABI, for peripheral vascular disease. They're looking for screenings for COPD with spirometry. They're looking for screenings for abdominal aneurysm and peripheral vascular disease with ABIs. Those things dramatically increased our star ratings, which helped us with our bonuses. At the end of the year, we generated significantly more money. Not only did we get paid for the testing itself, but we also increased our revenue by improving our bonus checks with the Medicare Advantage plans.
Every day I perform several physical exams on patients, and as part of our physical exam we've included the Patient 360, which is a set of 6 screening tests that we perform. I explain that to the patient that we're going to perform these tests. They're very simple to do, they're non-invasive, they're not painful, they're going to lay on the table with their clothes on and their shoes off, and we're going to screen them. They're very enthusiastic about that. Once I explain that to them, I explain to them that most likely the tests are going to be normal, but we don't know if they're normal until we find out. In the rare instances that we find something that's abnormal, we can uncover something that's very important to know about that particular patient. The patients are very enthusiastic about having these tests performed, and we've been very successful incorporating them into our regular physical exams.
We are a very patient-focused wellness clinic, and since partnering with Patient 360, we've been able to give patients a better comprehensive view of their overall health. We already do advanced blood testing looking for cardiovascular inflammation. This 360 testing can actually augment the test results that we get that gives the patient a much more comprehensive look at their overall health.
Having this available at our office has been incredibly valuable. Our physicals are now more comprehensive, and we have really seen that patients are grateful to have these screening tests available right then and there, and it's been incredibly valuable to our office.
In primary care, there's really only 2 ways to generate additional revenue, right? You can either see more people, which is pretty simple. You're either going to work more hours, you're going to work more days, you're going to hire more providers. Or you can provide more services to your existing patient population. That's where we come in. We partner with practices and we turn their traditional commercial annual wellness physical into an executive or a premier physical. The beauty of this model is we don't disrupt or change the traditional flow. The providers are going to do the exact same workup on a physical. The medical assistants are going to do the exact same workup, except now they're going to come back to our room. We're going to get the patient comfortable, lay them down. We're going to do a circulation study of the lower extremities. We're going to look at neuropathy. We're going to do a heart rate blood pressure variability study. We're going to use an ultrasound to look at their carotid, their AAA. We're going to do a very comprehensive lung function study, including forced vital capacity, lung diffusion, and lung volumes. We're going to do a steadiness fall risk assessment. We're going to do a bone density assessment, and we're going to do 3 medical eye exams: intraocular eye pressure, visual field, and fundus photography. All of these eye exams are going to be bundled together and sent to an ophthalmologist for interpretation, looking for glaucoma, hypertensive nicking, diabetic retinopathy, other diseases of the eye. When my technician gets really good and proficient at this, she's going to be able to do this in 22 to 25 minutes, so we're not adding a whole lot of time. And why physicals? The beauty of doing this as a part of a physical is physicals are no copay, no deductible. So we're able to do these screening studies on patients really without indication. We're going to let their plan handle us however they handle us, but we don't have to balance bill the patient. So now let's talk about the key qualifiers for our program. Number 1, the first you can kind of catch is we need space. We don't do anything mobile. We're going to take up the room of equivalent to an exam room, and we're going to fill that with equipment. Then I'm going to begin to find a local medical assistant, train her as a diagnostic technician that can be in your facility full time. So the first thing I need is space. The second qualification that I need is I need practices that are 60% commercial. We make no bones about it. Extensive physicals are for the worried well, for patients from 30 to 60. So that's a key qualifier. The last qualifier is it should be very easy for us to determine if we're a good match for each other. We're just going to look back at your practice management software. We're looking for practices that are already very pro annual wellness physical. We should be able to look back, see how many did you do yesterday, how many did you do the day before that, how many did you do the week before that. To qualify for our program, we're looking for practices that are doing 2.5 to 3 physicals a day minimum. And the beauty of this program, it's a win-win for everybody. The patients get the most extensive physical they've ever had, and it didn't cost them a dime. The providers get more data and a more clear picture of where their patient's at. And then, of course, the payers themselves get the opportunity to pick up on things early, get patients on therapy early, which is what they want. So it's a win-win-win program that you'll absolutely love.
It's been a great addition to our practice to add the Patient 360 to our physical exams. It's been a really good revenue generator for us. Haven't had any problems with the claims and no additional work on my part really. It's just been very simple, and we're really happy that we decided to go this route for our practice.
I am so grateful since we have been a part of Patient 360 due to the implementation of CMS measures for HEDIS requirements. Our office has been so beneficial of executing premier physicals, which have allowed us to hit all of those measures, which has also brought in greater patient care and incentives for our physicians. So if you don't have them, you need to have them.